Hi, I'm Dr. Abhilasha. So I actually met with an accident about 3 months back, a two-wheeler accident, and I had a shoulder dislocation and a greater trochanter fracture. 3.5 to 4 weeks post my accident, I met Dr. Raghu Nagaraj. So I was told that he is one of the best for shoulder related issues all over India. So I had a long-term follow-up with him. Initially, sir tried conservative measures. So post conservative measures, I developed a stiff shoulder. So sir advised to go in for surgery.
Abhilasha, who is a doctor by profession, she's an ophthalmologist basically. So she sustained injury to her shoulder due to a slip and fall. So because of which she tore one of her muscle called as the supraspinatus. Supraspinatus muscle is a very important muscle in the shoulder joint. So this muscle comes from the neck part and comes between these two bones and gets attached to the shoulder joint. So this is the main muscle of our shoulder which helps in moving our shoulder up and down, doing all the activities. Basically your strength comes from this muscle. So because of her fall, she sustained tear in this muscle. So because of which her pain continued in the shoulder joint. She was not able to operate her surgeries regularly. So she was having a sore shoulder most of the times. So the MRI showed a partial tear of the supraspinatus, which was a high grade in nature. Because of which, in spite of doing physiotherapy for 2 to 3 months, she could not recover completely with that. So that's the reason why we had to take her for arthroscopy surgery. So we did arthroscopy and we found that she had a very high grade tear of the supraspinatus. So in such cases, we do a special technique, what we call as an arthroscopic augmented biological rotator cuff repair. So over that repair, we put a patch which is made up of collagen from a bovine family group. So that collagen will help in regrow into a new tendon-like tissue. So that will help in recovering faster, especially for people like Abhilasha who has to go back to her practice and has to go and perform her surgeries quickly. So this helps in faster recovery, and also the pain after the surgery will be very minimal, and also the requirement of physiotherapy in such surgeries is very less. So patients can go back to their active lifestyle very quickly and immediately after the surgery. So that's how we did her surgery and helped her to go back to her normal lifestyle.
Dr. Raghu Nagaraj, I've heard from many people, is known to be one of the leading arthroscopic surgeons. So I'm pretty happy with my experience with sir. My journey of surgery, pre-operative and post-operative, was also quite comfortable. I was made aware of the procedure being done, and the team walked me through it quite well. So I would strongly recommend people with shoulder injuries to consult Dr. Raghu Nagaraj. Thank you.